this healthcare cost. So what can the provider and the payers do to manage that cost?
Sure. And I think, Marwan, you hit on something very important, which is chronic diseases. So if you just take diabetes as an example, obesity and diabetes, at least in the United States, has reached an epidemic proportion. And it's costing the country billions, and with a B, of dollars right now. And it's the same worldwide. It's no different than most other Western parts of the country. And you might ask, well, why is that? And it's because most healthcare has been focused on acute care. There's been very little focus on wellness and prevention. And when you talk about wellness and prevention, you just don't get that level of attention from most folks out there, because the payment system has not been aligned in that direction. And that's why I go back to saying that, at least what we're trying to do in this tri-state region, if you will, is to align the incentives of physicians, hospitals, actually all caregivers, and with the payer as the backbone, also align the incentives of the consumers, the patients, the consumers of healthcare, so that they also have the right incentives to do the right things, if you will. And so if you just take diabetes and obesity as one such example, and if you provide the right incentives to the population, to physicians in hospitals, to do what's truly in the best interest of the patient, and you align the payment in that direction based on that level of value, I think you'll see that, and the models are out there, by the way, you'll see that people will live longer, okay? Billions of dollars of unnecessary costs will be eliminated. It won't be eliminated, it'll be reduced. And physicians, as I said earlier, will be focused on what they were trained to do, which is provide care, and in this instance also prevention. And at the end of the day, care will become more accessible, more affordable, and the physician shortage we have now, at least in the United States, you'll at least have some relief. There are many parts of this country where people have to drive well over 50 miles to get the appropriate care that they need. And one of the reasons for that is that the healthcare system is saturated with working on diseases that are potentially preventable. And so at the end of the day, I think the focus on prevention and wellness will go a long way if we align the incentives. On the other end of the spectrum, we talked a little bit about innovation, and I think innovation will play a big role in also achieving that aim of reducing costs, improving quality of care, and so forth. I think you're going to see in the next 5 to 10 years a lot more penetration in the market with what we call telehealth. In other words, for providers reaching to the population, whether it's rural communities or otherwise, without having to go and make an appointment and see your doctor. There's a lot, the technology is advancing so rapidly right now, and it's currently being used, for instance, with stroke patients, where you can provide that level of care without having to be physically in the same room as the patient. There's a lot of technological advancements, and once again, if payment is aligned so that focus is there, knowing that at the end of the day you're going to get that outcome, I think you'll see that the costs will be driven down and the quality will improve.
Yeah. Thank you. That reminds me, actually, 2 weeks ago when Marwan was there was a healthcare conference in Dubai organized by The Economist. And they showed data from the Gulf, which is scary actually. Go back to obesity and diabetes, that very high, it's most probably the highest level in the world in percentages in obesity and diabetes with the young population. Mm-hmm. And so this is sort of a time bomb for the future. So maybe such models that the Gulf can benefit from the experience of the United States, because the United States has been working on it for a while in managing, obesity and diabetes. And I was talking to Marwan about that we need to reach to the policymaker in the country to alert them from this trend, increased trend. I think, Marwan, if I'm not mistaken, diabetes in the UAE percentage is around 32%.
Yeah,
32,
high,
which is really high. And so this is something that we as healthcare industry, we need to start engaging with policymaker and bringing some of the models that has been on prevention, on others in the United States, and then bring it to the region there.
Yeah, I mean, I would agree with Dr. Tony in terms of aligning incentives. So, for example, there are a lot of companies with technologies that would, really reduce the number of visits to the doctor.
Right.
But the healthcare providers, they want the patients to come.
Right.
So from the one side, you want to prevent, you want less visit to the doctor. On the other side, you have people who want to visit them and stay at their hospitals more and more. So how do you manage this? And I mean, I can relate to my case with my two little kids, where with the first one, we were rushing to the doctor for every little thing. But then when we learned about, the flus and the coughs and things like that, and we read and we educated ourselves. So we with the second one, we didn't even go to the doctor. So, but again, who benefits here? Yeah. And it's important to align incentives, I think.
Thank you. So I had to note that there is a video want to be shown before we go to the question and answer. So maybe it's the time now to show that video.
Most asthmatics describe the feeling of breathing through a straw.
Clinical trials is good business for the state's economy.
There was real hope that if you had HIV and AIDS, you weren't going to die. Up until that point, I don't think we reached it.
The very first Pharma Research and Hope Awards.
They are pioneers. Their contributions inspire us all.
Connect socially with patients, with doctors.
We love this industry for a couple reasons. It saves people's lives, and secondly, it provides tremendous employment opportunities.
Medicine saved my life.
This is an extraordinary time for cancer research.
This progress is real, tangible, and it takes us from hope to cures.
So I'm sorry that the video is from 2012, but we are trying to manage cost also. So it's, maybe it's time to open it for questions for the panel. The microphone here, please, Dr. Salam.
Thank you very much for a very interesting panel, and I enjoyed listening to it. And today is the birthday of Salk, the professor at University of Pittsburgh who made the Salk vaccine for the poliomyelitis. A great innovation that started the a new world for many people and saved the life of many people. And he didn't get much for it, Samir. You see, the guy didn't have intellectual property at the time, and this went to the whole humanity, including black and white, Christian and Hesian and everybody. And really, this is what I feel about health. Health is different from anything else. We can talk about industrial, smart houses. We can talk all about these beautiful things, and it's not essential for the life of the whole population. But I just want to give a small example for you that here in this country, for example, you don't have a primary health care. And this is the best country in the world, the best spending that you ever see in your life per capita for medicine, but you don't have a primary health care. And I myself, I go to my doctor, and I miss having a primary health care, which which you see in Britain. And that's why I feel it is a little bit, a lot of burden on pharma, on the other, because we don't have something to stop some of the expenses that goes away, and they cannot support the drugs industry sometimes. I'm all for innovation, but I think you said something which is very crucial. You said that you have many players. That's why this pulling from this side, and this is making a new regulation, and this is so. That shows you how difficult it is. But if you work all for a common matrix, that will give the innovation its right, and we give the unprivileged its right, it's going to work all over the world. But if it doesn't, everybody will start breaking part of it, and it's starting to get away, and he feels he's like a prophet because he's trying to give something to the poor. And that's where I feel with pharma, with these big companies, a new issue should arise. Instead of you spending, I know you're spending a lot of money on the unprivileged group and supporting some generic drugs and doing something, but if it is done in a piece of art that will save these big companies and make it more for innovation, I think this could change. This is a new a vision that should be a new strategy. And also for health, for developing countries, you can't run health without having primary health care. And I just want to give you an example, since you are now the one who's going to look after me in the next year. I'm treated for mild hypertension. And my back also is bad a little bit. By the month of September, I only get generic drugs. And by the month of September, they tell me you are now in the donut hole. How come if somebody is taking generic drugs? And that's where I feel even pharma has the right to say, okay, these are their innovations, and even when you made it generic, it's not accessible for many of the people. I feel innovation should be encouraged. We should widen our scope to get better, something better every day. But we should have a matrix to work on it, and also like what we did before, the intellectual property, I think this could be modified to accommodate for everybody to have the right thing, so that you do not play games with regulations and rules that I know you suffer a lot from it in our Middle East. I thank you very much for a very interesting discussion, and I wish you all the best, and I'm really happy with this meeting and with what you're achieving today. Thank you very much.
Thank you. Thank you.
Samir, should we respond? Is there time for a response, or?
Do you want?
So, Mr. Minister, thank you for your intervention. A couple things. Again, today I addressed more the industrial policy side. How do we make countries more competitive in our sector? I think the Arabic word is at-tanafasiyya, right? So how do we boost at-tanafasiyya in Egypt, in the Emirates? Because we have a lot of good people And there are a lot of opportunities there. We have many times established universities, hospital systems. We have good clinicians. But in terms of, you know, Egyptians making a contribution to global healthcare today, right, to innovation, let's be honest about it. A lot of the Egyptian contribution is today happening outside the country. So Egyptians working in US universities. And I could go down the list. It's true for Russia. It's true for Turkey. And that's all great. And we take pride in them. We read about them in the newspapers back home. And we say, wow, you know, our sons and daughters in Boston or Pittsburgh are making significant contributions to healthcare, global healthcare. That's all good. I think what we're trying to do locally is create the conditions for more R&D locally, more manufacturing locally, more exports from those countries that have an export agenda. And I think that there's a lot of complementarity, actually. Typically, when we're talking about more transparent regulatory systems, that applies to the innovator companies and to the generics companies. We talk about more predictability in policy making. That's true. I think the physicians want that, the hospital sector wants that, the medical device folks want that. We'd like to see that. Now, ultimately, this may be my last opportunity, but I think what works really well, it's not just this policy or that policy, right? Great intellectual property, you know, great world-class patent law. Yeah, that's important. Or harmonized regulatory. Yeah, that's important. I think that what we're seeing in Eastern Europe, Middle East, Africa today is that the countries that are really getting ahead, the countries that are really becoming competitors, tigers in the field, are the ones that have hit on the biggest, you know, the biggest secret to success of all, which is dialogue. These guys are actually talking to us, and they're talking to the companies, to the sectors, to the investors. I mean, picture that, $100 billion a year. My company spends $8 billion a year in R&D. You want to talk to those companies. And I'm encouraged back home in Egypt, we're actually having that conversation. You've got a new health minister, new minister of industry. We're having that conversation. The president's a supporter.
Let me just say a small word. You're talking to people who have got the 100 billion, but you don't talk to people who haven't got the 100 billion, and that's the problem. I was a minister of health for 6.5 years, right. And this is the longest ever stayed in Egypt. And I tell you, at the time I was a minister, I got everybody to have his operation, to have his drugs, to have all this. And this is feasible. But just let me tell you, I would like to see you working with these people also, not only working with the rich countries. Yes, I would love to work with Dubai. And if I have an investment, I will better put it in Dubai than to put it in Egypt if I'm just oriented to economy or economic benefit. Right. But you know, you have to work with with the people who have the 100 billion and the people who have only 1 billion. And I think this is very important for the success of the pharmaceutical industry, because you want to get you don't want to get loops in the industries.
And I would just say that in Egypt, that in the last, I think it's the last 9 months, 10 months, we have set up a committee of private sector companies that are advising the health minister there, the Minister of Industry, on how Egypt could become more competitive in the sector. Egypt has tremendous potential in our sector, but it hasn't always put the policies in place. That's what we're working on now.
So Dr. Farah, I think, wants to say a few words related to the same issue, right?
Yes, so I'm glad you mentioned primary care. You're right. In the United States, we have a significant shortage of primary care physicians, and the reason for that goes back to what I said earlier, which is that this fee-for-service environment has really incentivized medical school graduates to go into subspecialties and surgical specialties as opposed to primary care, which is why there's been little emphasis on that. And so I think the solution really is not to spend more dollars in healthcare, but to shift where those dollars are being spent, at least in the United States, away from unnecessary care toward paying physicians, first of all, for value, as opposed to just volume. And then secondly, these escalating, it's a vicious cycle we're in right now, which basically is unsustainable. And so it's 18% or so of the GDP in the United States we spend on healthcare. If you just take a small fraction of that and change the incentives, you'll get a lot more primary care. Providers will provide the right care. And at the same time, this donut hole that you're talking about basically should go away.
Thank you. Thank you. I mean, we can go on and on this very important issue. We have 10 seconds to go, but maybe we have time for one question quickly. Yeah, in the back there. Yeah.
Hi. So I'm still not clear how this American health insurance system is going to work in Dubai, as Mr. Janahi mentioned that Dubai is really new to the health insurance policy and stuff. And then also, like, why would people want to pay for the insurance while they will be receiving the universal health care, or like they can even always get high technological healthcare from other industrial countries, and how are these companies going to encounter the challenges?
Okay.
Marwan?
So I was just using insurance as an example where it can influence the industry, the pharmaceutical industry. So currently, the way it is in the UAE, and it's the case because it's a new country, insurance scheme is not universal, and only a certain portion of the population have insurance, and the rest of the population basically pay out of their pockets. So now the plan is that by 2016, early 2016, there will be a full coverage, meaning that the payers or the employers would be paying for the insurance, and the government will also cover part of the medical care. The reason why it will have an impact, in my opinion, is that people will then want to know about what they pay for. So because if you have a bigger population, you want to make sure that whatever money you spend on your people are actually spent in the right way. But if you have a smaller number of population and it's very a certain sector, then you don't really care, and so you have a lot of cases of overprescription, for example, people staying at the hospital more than what they need, and this is not good. So I think things like wellness programs, prevention programs will really kick into the sector, and companies that do telemedicine and wearable devices, for example, will also be a big part of the society. So I'm actually looking forward to it. I think it will change the sector in a very positive way.
Thank you very much, and please join me in thanking our panel. Thanks.